Good morning. Good morning, everyone. Welcome to the 2025 North Carolina Institute of Medicine annual meeting. I want to say thank you to all of you for taking the time to be here with us today. I know that so many of us in the world of public health and health policy right now are faced with great uncertainty as we navigate changes to funding, programs, and resources, and as we work toward what is our common goal, the opportunity and access to health for all North Carolinians. So it is especially meaningful to us that you are here today to take part in discussions on an incredibly important topic for our state, Healthy North Carolina 2030, and where we stand as we work to meet the goals laid out in our state health improvement plan. So I'm Michelle Reese. I'm the president and CEO of the North Carolina Institute of Medicine. This is my second annual meeting in this role, and I'm really excited to see so many familiar faces around the room, as well as a lot of new ones. I was wondering if folks could raise your hand or stand up if this is your first NCIOM annual meeting. Oh, good. Oh, that's wonderful. Great. Thank you. And then I also want to recognize the people who have worked with us before. Your expertise and your perspectives have been so important and vital to the work that we do. So if you have served on a task force, an advisory committee, written an article for us, had a phone call with us, please raise your hand. All right. Wonderful. Thank you. Because that's absolutely how we learn what we need to work on and how we need to do it. Also, if you are an elected official, please stand. Wonderful. Thank you for being with us today. And last but not least, I do want to also recognize our NCIOM staff for the incredible work that they all do, making sure that our projects move forward, and especially today, organizing this event for you. NCIOM staff and NCMJ staff, please stand as well. Okay, great. Thank you. So if you have any questions, our staff will be around throughout the day. Please find them if you need any help with a breakout room or with anything else throughout the day. So before we dive into today's agenda, I do want to talk a little bit about our organization and our mission and values at the NCIOM. So we are an independent, nonprofit organization committed to better health for everyone in North Carolina. We were chartered by the General Assembly in 1983, and since then we have worked to provide nonpartisan information and opportunities to all who impact the health of our state. We do our work by convening people from all walks of life from all across the state to build consensus on issues relevant to health and well-being. This work takes many shapes, including convening task forces, publishing the North Carolina Medical Journal, and hosting virtual and in-person events like today's annual meeting. And just a quick plug, if you don't already, you can also follow us on LinkedIn and X at NCIOM. Tag us if you post about the event today. We would love to see that. So here with me today also is NCIOM's board chair, Adam Scholar. Adam is the president and CEO of the North Carolina Healthcare Facilities Association, and he has served on our board since 2020 and as the chair of our board since 2024. And we are so grateful for his leadership.
Thank you, Michelle, and thank you. I'm proud to be here representing the NCIOM's Board of Directors. The work that you will hear about in a few minutes just scratches the surface of the organization's staff and the effort they put into building consensus for solutions to some of the biggest health challenges that we face. The mission of the NCIOM is evident throughout the work they do, through recent task forces and the thorough policy recommendations they lay out, through the Legislative Health Policy Fellows Program and the legislators and staff who gain deep knowledge about public health and how they as elected officials can help shape statewide policy. And as a leader on initiatives like the topic of today's event, Healthy North Carolina 2030, that truly shape the direction of our state. The NCIOM staff's commitment to collaboration and evidence-based policy continues to guide the work that they do. I'll turn the mic back over to Michelle to share some more about the projects that have taken shape this year.
All right, wonderful. So first, our new task force on veterans health, which we launched this year, funded by the DHHS Division of Mental Health, Developmental Disabilities, and Substance Use Services, and AARP North Carolina, is working to identify opportunities to improve access to and experience of care in community-based settings for veterans, their families, and their caregivers. In our first meetings, we are already learning about stigma, especially associated with mental health and substance use treatment. We are also hearing about existing programs and people who have spent their careers figuring out how to best serve veterans, as well as opportunities to lean in and improve access and awareness. This task force will wrap up in May 2026 with a report to be published by next November, so we'll probably be talking about that at next year's annual meeting. In partnership with DHHS also and the Perinatal Health Equity Collective, we are continuing to advance efforts to address maternal care access through the Maternity Care Desert Workforce Solutions Action Team. This year, we have convened 5 meetings with cross-sector participants to identify strategies to strengthen the workforce pipeline, promote collaborative care models, improve rural access, and shift systems and cultures for sustainability. We have also published 4 new reports this year with partners like NCIOM, DHHS, the Association of County Commissioners, and the North Carolina Center on the Workforce for Health. So first, the Child Health Report Card. So for nearly 3 decades, we have partnered with NCIOM to publish this biannual publication, which serves to provide a snapshot of the health and well-being of our state's children and to shed light on successes and challenges in promoting children's health. Across topics including healthcare utilization, maternal health, economic factors, education, and more, this report card helps bring focus to the ways that North Carolina can improve health and well-being for children and families across the state. This year's Child Health Report Card also featured a special section addressing school-based mental health services, which also addressed the need to look holistically at the factors contributing to the youth mental health crisis if we want to improve outcomes for North Carolina's children. We also worked with DHHS to publish Building Resilience and Promoting Well-Being, an updated action plan for North Carolina children and families. This report was based from an update committee that convened from July to October of last year, and it really provided an update of our 2015 Task Force on Essentials for Childhood. Essentials for Childhood is the CDC Population Health Framework for Child Maltreatment Prevention, and both the 2015 Task Force and the 2025 updated plan focused on supports that families need to reduce stress, promote economic security, and foster resilience. We also published an updated opioid research agenda this year, building off a 2018 report. This report takes into account the trends and policy changes that have taken place since 2018 to set new priorities for research to understand and impact the rapidly evolving drug overdose epidemic. Our report, Building North Carolina's Direct Care Workforce, represented the culmination of a sprawling workshop series involving more than 110 individuals seeking answers to important questions including, how do we define direct care workers? What types of data are available, and how do we make sure direct care workers and employers are engaged in research? And what different strategies, policies, and approaches could help expand and stabilize this workforce? We engaged in this work with our partners at the Center on the Workforce for Health, who we also worked with to reconvene our task force on the future of the nursing workforce this spring. Members from the original task force joined us to look at their original recommendations, prioritize action, and discuss what has gone on since the release of that report. We also have some exciting updates from the North Carolina Medical Journal. So this year we transitioned the journal to digital-only publishing, and we have published 3 quarterly issues so far this year. Our April issue focused on navigating disaster relief, followed by our July issue on pharmacists as catalysts for better health. We also just published our fall issue on the topic of today's event, Healthy North Carolina 2030. In this most recent issue, we explored how far Healthy North Carolina 2030's shared roadmap has brought us toward improving health for all North Carolinians. Authors, including experts on education, food access, community health work, data analytics, substance use, health policy, and health infrastructure, reviewed the goals and measurable targets from the initiative and discussed what it means to turn the curve toward better health. I want to say a big thank you to all the authors who have contributed to the journal this year, and please stay tuned for our final issue of the year, which will be all about Medicaid in North Carolina. As we look to the new year, we're also actively gearing up for our 2026 Legislative Health Policy Fellows Program, the 5th cohort of this program that began in 2018. This program has brought together so far over 80 legislators from the North Carolina Senate and the North Carolina House of Representatives, covering 24 Senate districts, 38 House districts, and representing 52 counties across the state. These fellows come together over a 4-day curriculum to dive deep into data, information, and knowledge necessary to guide effective health policy. Throughout the first few months of next year, our new cohort will meet with each other, with our staff and expert guests to advance their understanding of the health issues that face our state, examining the strengths and challenges of our systems, and exploring innovative opportunities we have to help people improve their health and well-being. I'm going to turn it back over to Adam for a moment.
All this great work wouldn't be possible if not for the organizations that share in the NCIOM's mission. We would like to thank all of the organizations and individuals who support our projects and our organization as a whole for their support, guidance, and partnership they offer so generously year after year. And as the chair of the NCIOM board, I also want to recognize our board members who come from all corners of our state. Next year, we will welcome 5 new board members appointed by Governor Josh Stein, North Carolina Senate President Pro Tempore Phil Berger, and North Carolina Speaker of the House Destin Hall. Those 5 individuals are Christopher Grubb, Ritesh Kumar Patel, Ubajit Roy Chowdhury, Jeffrey Keith Smith, and Michael Tart. Welcome to the NCIOM board. As we round out 2025, our board is also saying goodbye to several members whose terms are coming to an end. Those individuals are William Way, Anita Bachman, Ryan McGinnis, Betsy Tilson, Corey Hess, and John Morrow. Thank you so much for your service on the NCIOM board.
Thank you, Adam. I did want to echo Adam's thanks here and thank our outgoing board members for their service to the NCIOM. And to our incoming members, we're very excited to have you join us in the new year. Before we transition to the rest of our program, I did want to take a moment to thank Adam in particular again for his service as the chair of the NCIOM Board of Directors. Our chairs serve for 2 years, so Adam is coming to the close of his service as chair in about a month and a half. So we wanted to say thank you and formally thank you for your service and your leadership. So thank you. Adam's guidance has been incredibly valuable to the organization, and he's just left an incredible legacy. He's not leaving our board, but he is leaving this position. So, now throughout today's event, you will hear from many expert speakers about the many different health indicators outlined in Healthy NC 2030. This decade's initiative, which is the 4th iteration since DHHS began to release this report in 1990, runs parallel to the National Healthy People Initiative. We partnered with DHHS and the Division of Public Health to lead the 2030 process, which deviated from past goal-setting processes by placing a special focus on drivers of health. The 21 health indicators and targets that were chosen for this initiative served as the foundation for our state's health improvement plan. So the topics and data that you will hear about today are deeply ingrained as our state's health priorities, and they lay the foundation for policy recommendations that will shape the future of North Carolina. Our plenary panel will dive into the last 5 years and discuss how health crises have changed our state and what that means for the rest of the decade. Breakout panels this morning will discuss federal decisions and their impact on state public health, overdose deaths and how policy and local innovations are saving lives, and housing policy and the role of community voice. This afternoon, you'll also have the opportunity to hear about food-related needs in North Carolina, innovative approaches to suicide prevention, and how policy and health communication affect sexual health. And I hope you can also stick around for our legislative roundtable at the end of the day, where legislators will talk about building a whole-of-government strategy for North Carolina. And in just a moment, you'll have the opportunity to hear from our keynote speaker, Dr. Umar A. Shah. I also want to thank today's sponsors who have made this event possible. To our presenting sponsor, the North Carolina Department of Health and Human Services Division of Public Health, thank you for your support and your ongoing partnership on this work. And with that, let's begin the rest of our program. It is my honor to introduce North Carolina's Secretary of Health, Dr. Dev Sangbai. Dr. Sangbai was sworn in as Secretary in January of this year. Prior to joining the governor's cabinet as the first Indian American cabinet member to serve under a North Carolina governor, he worked as a family physician and as a professor at Duke University. He served as president of Duke Regional Hospital and president of the North Carolina Medical Society, and his work has focused on improving access, developing the healthcare workforce, and making care more efficient. Secretary Sangbai, thank you for joining us.
Thank you for that kind introduction, and it's great to see the partnership between the agency and IOM. We really rely on the expertise of the IOM and its convening power to really help us understand where we need to prioritize for the state, what we're doing well, and where we need to improve. So it's an honor to be here today with so many colleagues and partners from across the state. You know, anytime you give a presentation like this, you always say, hey, I see a lot of familiar faces in the audience. Even if you don't, you say that just to kind of take the temperature down a bit. But I honestly see so many familiar faces, and I wish I'd arrived earlier because there's so many people I want to say hi to and thank you to. But I think it really represents what we have in North Carolina is just the collective brain power to help us solve so many of the challenges that we have. The IOM's Healthy North Carolina 2030 initiative is really a guiding light for us at the agency, the General Assembly, and partners as we work on healthy communities. To put a finer point of it is we actually keep a copy of this in the main conference room where my leadership team meets. And when issues come up, we always go to Healthy North Carolina 2030. We've moved to a new location, so we got to get that cadence back. But for example, as many of you know, we faced some challenges to the tobacco work that we were doing, probably some of the earliest challenges that we had in this calendar year. And one of the first things we did is pull out 2030 and say, where's it going to impact what we want to do? What's it going to do for some of those goals that we set? So the work of the 2030 and hopefully 2040 when we get to it is going to be so critical. And I appreciate the work that you're going to do today to really think about where we are in those key areas. It helps the work that we're doing in public health. It really helps us understand how we're focusing on whole person well-being around physical and mental health. So as you gather around the work on 2030 right now, I want to put maybe a different spin on it. This would have been a natural midpoint check, I think, in the work. It's 2025. We're looking at Healthy North Carolina 2030. But I want to paint a picture of a little bit of what we're facing, and hopefully that sits in the back of your mind as you're thinking about things. These are really unprecedented times. You're going to hear from other members of the agency on how our work is changing and how the forces that are being compelled upon us are helping us drive the way that the agency is moving forward. There are things that historically we said never going to go away, can't be touched. They're being touched. Some of them are going away. And that's not intended to be an editorial comment. It's just the reality of where we are. One of those realities, unfortunately, is that we are facing the same challenge that all 49 states and territories in the United States are facing. The needs are outpacing the resources that we have to meet those needs. And we see that across the board. We have made some changes in our Medicaid program that I know are wholly unpopular, and I will say the person to whom it is the most unpopular is me. But you're going to see the rest of the state doing the rest of the country doing many of the things we are, because we're all facing those challenges. So our moment, honestly, is right now to kind of think about how we're going to take what we know, what we have learned over the last 12 months, what we have learned over the last 5 years, how we can forecast for the next 5 years, and what does it really mean when we want to create a healthy North Carolina? We're doing it on the backs of a global pandemic. So 2020, when this thing came out, was after, really it came out at a time when we hadn't even contemplated what it meant to have a worldwide pandemic. 2 years ago, we had a phenomenal weather event that had completely changed the landscape, literally, of a quarter of the state, of the western part of the state. Changing the landscape physically, changing the landscape in terms of what's available for healthcare. I see several people in the audience who were instrumental in our recovery. And our ongoing recovery. So we're going to have to figure out how we continue to meet the needs of western North Carolina. It's just not the western part of the state. As we think about the rural nature of North Carolina, how are we going to continue to meet those rural needs? So I'm excited that the group is here today to kind of think about all of those things as we look forward to how we close out the decade that's going to be North Carolina 2030, but really kind of forecast what we're going to be doing in the future. So you might be saying, you know, can you tell us something good, Secretary? Because I don't want to make it sound like it's all doom and gloom. But I think that framework is important, but it's also important to kind of think about what we have in North Carolina. I started by saying the enormous brain power that we have in North Carolina, and I sincerely say that. I work with several other counterparts in other parts of the state, and they often will tell me North Carolina has such powerful convening power, conveners like the NCIOM, think tanks like the Duke Margolis Institute, enviable institutions of higher learning, places like the Shep Center where you can look at data in ways that other people don't even know how to look at data. We have the ability to do that kind of stuff in North Carolina, and here's the framework that we have to do it. We still have Medicaid expansion, 680,000 individuals. That's remarkable. And I was fortunate to be a part of a hospital that actually got to see what it meant to be pre-expansion to post-expansion. And a couple things we saw. People came to the emergency room with more comfort. Fewer people came. It actually works, guys. You know, you actually give people insurance. They go see their doctor. They see their healthcare provider. They don't come to the emergency room. Fewer hungry people in the emergency room. And I know there's a lot we can talk about with respect to hunger and so forth, and I'm excited that hopefully we're going to be turning the SNAP benefits back on as the federal government has a continuing resolution. But those are the things that we need to kind of think about. But expansion has been huge for North Carolina. What it's allowed us to do is given access, as I said, to 680,000 individuals. It's given hope to individuals who previously didn't have hope. And it's allowed us to prop up the North Carolina economy. So the entire Medicaid program in North Carolina contributes somewhere around $30 to $40 billion over 10 years to the North Carolina economy. So when you kind of think about that in the context of what that means, you're really here to also think about rural economic development. You're here to kind of think about how do we prop up the North Carolina economy. There are other things that we have done in North Carolina. So we have Medicaid expansion. The work we've done around behavioral health has really been life-changing for many individuals. We hear about individuals who are now saying, when I have a mental health crisis, I have someone to call. I can call 988. I can have someone to call. I actually have someone to respond. And we've also figured out how to get to the next step of somewhere to go if you're really in crisis. And so we've set up a system that helps us understand that if an individual's in crisis, that you're not alone. But we set that up because of the individuals in this room and others who thought about what we need in North Carolina. We realized that transitioning from being in the justice-involved space without having a smooth transition, there are so many risks of re-entering the system or failing in the community and the community failing you. So we've put in together numerous initiatives to be able to do that, working in partnership throughout the state. One of the things that I'll admit that I had the least understanding of when I took this job is the important work that this agency does, that many of you do, in helping our most vulnerable children. So we've put together a program now that allows individuals, particularly those kids who are still spending nights in the emergency room, still spending nights in administrative offices and DSS centers because they have nowhere to go. We're putting a system together so that number becomes 0. We look and we follow, what's that number? The only acceptable number is 0. So what have we done to be able to do that? It may surprise you that up until July of last year, or July of this year, that if you were in Guilford County working in DSS and there was a child who had needs in Forsyth County right next door, the ability to communicate between those two counties was limited because we did it on paper. And often cases where individuals were 30% understaffed with labor. So we put together a program the General Assembly funded called Path NC, and by this time, probably by the summer, all 100 counties will be on a single platform that does consistent screening for vulnerable children, that allows that ability to be seen across all 100 counties. We put together a system that allows children who have family in counties that are hundreds of miles apart to be able to place in those counties, found ways to support those financially. And then we're going to put together at the end of this year, launching a health plan that ties that all together. So as you think about the most vulnerable group, yes, that's actually a round of applause for everyone in the room, quite frankly. So as you think about the kind of things that we're doing, there's really an opportunity to be proud of the work that we've done, to think about the most vulnerable children and how we're supporting them. There are many other things we can talk about that are successful. The other thing I'll talk about, which for those, how many providers are in the room? Healthcare providers, direct patient care? Oh, a handful of you. So we have 13 hospitals and facilities that the agency is responsible for. Again, everything was done on paper. So we finally went on an electronic health record that's going to allow us now to have individuals. Imagine having a loved one in one of those facilities and you don't have line of sight to what's happening. And we can say whatever we want about patient portals with EHRs and so forth, but that's a view that individuals are now going to get that they couldn't get. And for those, the reason I asked who are the providers in the room, I know we have been doing that for a long time period, but it gives us that line of sight, that modernization. So we're doing a lot of stuff on the IT side as well. You can hear more about some of the phenomenal work we're going to be doing in AI and a few other things to really modernize. So I'm going to end on all the good things that are happening, and hopefully I've convinced you that despite the fact that there are some challenges, there are a number of things that I have in North Carolina that are really good and things we can build up on. So I'm going to close here by just saying thank you again for the important work that you're doing, and end on this idea that please leave with the work that you're doing, the work that you're resetting or reevaluating, revalidating on 2030, the eye to 2040 that I think we're eventually going to have as a tool for the agency to do its work. There are so many forces that the agency is facing. We need a playbook. Healthy North Carolina 2030 is our playbook, so I hope you design some pretty creative plays, maybe some gadget trick plays in there that nobody sees in their playbook, because we really need your guidance to help us think about how we really can make North Carolina the healthiest state in the nation. Thank you very much.